Before we begin, I want you to do something for me. If your blood pressure pill is nearby, go get the bottle right now. I'll wait. Hold it in your hand and read the name on the label. Does it say Amlodipine or does it say Losartan? For millions of people over 65, it says one of those two words. Now here is the question almost nobody stops to ask. Someone chose that specific pill for you. A doctor wrote it down, a pharmacist filled it, and you have taken it faithfully, maybe for years. But did anyone ever sit down and explain why that one? Did anyone tell you whether it's truly the safest choice for a body that is now over 65? Most people assume a blood pressure pill is a blood pressure pill. The reality is very different. Amlodipine and Losartan share the same goal, lowering your pressure, but they do it in completely different ways, and they affect an aging body in completely different ways. One can make your ankles swell. One can quietly protect your kidneys. One has even been linked to your memory. Today, I'm going to walk you through exactly how these two compare, and by the end, you'll understand which one may be safer for a body like yours. Let me tell you what I think your life with this pill actually looks like, because I suspect I already know. Every morning, without fail, you take it. You are not careless with your health. You've been responsible, consistent, exactly the patient a doctor hopes for. But somewhere along the way, you started noticing things. Maybe by evening, your ankles look puffy, and your socks leave deep rings in your skin. Maybe when you stand up too quickly, the room tilts for a second and you have to steady yourself against the counter. And a quiet thought crossed your mind. Could it be the pill? But you didn't ask. Because the last time you were in that office, you had maybe 7 minutes. The doctor was kind but rushed, already reaching for the door handle while you were still forming the question. So you swallowed it, along with the pill, and you went home wondering. If that is you, I want you to hear this clearly. You are not imagining things, and you are not alone. Thousands of people your age are sitting with the exact same unspoken worry, feeling dismissed, feeling like a number on a chart, rather than a person with a body that has changed. That worry of yours is not silly. It is not overthinking. It is valid. And today, finally, without a clock ticking and without a door being held open, you are going to get the full explanation you deserve. Now, here's where most people go wrong before we even start. They ask, which drug is better, Amlodipine or Losartan? And I understand the instinct, but that is the wrong question, and asking it will only confuse you. There is no universal better. A pill that is perfect for your neighbor could be the wrong choice for you. The right question, the one that actually protects you, is this. Which one is safer for a body like mine? That single shift changes everything. Because the answer depends on your kidneys, your ankles, your balance, and even your brain. By the end of this video, you will know exactly which of those factors decides the answer for you, and you'll be able to have a real, informed conversation with your doctor instead of just nodding along. I'll also share one recent finding about memory that very few patients have ever been told, and it may genuinely surprise you. I work in preventive health and senior wellness, and my mission is simple, to give you plain language, honest information, and the respect of a full explanation. Right now, do me a favor. Drop a comment and tell me which pill you're on, Amlodipine or Losartan. I read them. Now let's look at how these two actually work inside you. Here is something most people take these pills for years without ever understanding. Amlodipine and Losartan don't just differ slightly. They do fundamentally different jobs inside your body using completely different tools. Let's start with Amlodipine. It belongs to a family called calcium channel blockers. Now, your artery walls have tiny muscles wrapped around them, and those muscles need calcium to squeeze and tighten. Amlodipine blocks some of that calcium from getting in. With less calcium, those muscles relax and your arteries widen. Picture a garden hose that's been pinched tight. Loosen the pinch and the water flows through with far less pressure. That is Amlodipine. It physically opens the pipes, and it does so powerfully and quickly. Losartan works on a completely different principle. It belongs to a family called ARBs, angiotensin receptor blockers. Your body naturally makes a hormone that acts like a signal, telling your blood vessels to tighten and your body to hold onto salt and water. Losartan blocks that signal from being received. Think of it like turning down a thermostat that keeps cranking the heat too high. Nothing is forced open. Instead, the instruction to constrict is quietly switched off. So one drug is loud and mechanical, prying the pipes open. The other is quiet and hormonal, calming the system down from the inside. Both lower your pressure. But that difference in how they work is not a small detail. It is the entire reason they cause different side effects, offer different protections, and carry different risks. And here is the part that matters most. That difference becomes far more important the older you get, because an aging body responds to each of these approaches in its own way. So let's talk about what happens when these two very different pills meet a body that is over 65. Most people assume that if a medication was safe for them at 45, it's automatically safe at 75. The reality is that your body has quietly changed in ways that change how every pill behaves. Let me explain what's different. First, your arteries. In a younger body, artery walls are elastic, springy, able to stretch and recoil with each heartbeat. As the decades pass, those walls naturally stiffen, a bit like a rubber band that has hardened over time. Stiffer arteries mean your blood pressure can swing more dramatically, spiking high and then dropping low. Second, your blood pressure control system becomes less reliable. When you were young and stood up quickly, your body instantly adjusted to keep blood flowing to your brain. That reflex slows with age, which is why standing up can suddenly leave you lightheaded. Third, your kidneys. They are the organs that filter your blood and manage your fluid and minerals, and they naturally filter more slowly as you age. That matters enormously because some blood pressure drugs lean heavily on your kidneys. And fourth, you are simply more sensitive to falling, and the consequences of a fall are far more serious now than they once were. So here is the truth that ties it together. Safe at 45 is not automatically safe at 75. The very same pill, unchanged, can behave very differently inside an older body. This is not a reason to be afraid. It is a reason to be informed. Before we go further, I'm curious. Type your age in the comments. It helps me understand who I'm talking to. Now, with all of that in mind, let's examine the first and most visible way one of these pills reveals itself, the swelling that so many of you have already noticed. If you're taking Amlodipine and your ankles or lower legs have been swelling, I want you to know that this is not a mystery, and it is not your imagination. It is one of the most common and most predictable side effects of this drug, and it has a real, understandable explanation. Remember how amlodipine works by opening up your arteries, the vessels that carry blood toward your tissues? Here's the catch. It widens those incoming arteries far more than it widens the outgoing veins that carry fluid back. Imagine a sink where you've opened the faucet wide, but the drain stays partly closed. More flows in than can flow out, and the pressure pushes fluid out of your small blood vessels and into the surrounding tissue of your ankles and feet. That's the swelling. Doctors call it peripheral edema. And here is what many people are never told. It tends to be more common in women and more common in older adults, exactly the people most likely to be prescribed it. So if you've noticed it, you fit the pattern perfectly. Now, I need to be honest with you about something important. This swelling is, in the majority of cases, uncomfortable and frustrating, but not dangerous in itself. However, it is also the single most common reason seniors quietly stop taking their blood pressure pill without telling anyone, and that is genuinely risky. Please don't do that. There is a fix, and I'll give it to you later in this video. Here's the contrast you need to hold on to. Mild, even swelling in both ankles that comes on gradually is usually the harmless kind, worth mentioning to your doctor but not an emergency. But sudden swelling, especially in just one leg or swelling with pain, redness, or warmth, is a completely different situation that needs prompt attention. We'll cover those warning signs clearly before we finish. For now, understand that swelling is amlodipine's signature trade-off. But it isn't the only concern with this pill, and the next one is one that very few people ever hear about. Here's what most doctors never take the time to warn you about when they hand you a prescription for amlodipine. In the early period after starting it, this medication can raise your risk of falling. That's not fear-mongering. Careful research studying older adults has found that amlodipine, particularly in the first year of use, is associated with a higher risk of falls compared to some other blood pressure options. And the reason connects to everything we've already discussed. Amlodipine lowers your pressure powerfully, but in an older body, whose reflexes for adjusting to sudden position changes have slowed, that strong effect can cause your pressure to drop too far when you stand up. The result is that brief, swimming dizziness, the moment where you reach for the wall, and in a body over 65, that single unsteady moment can lead to a fall. Now I want you to sit with why this matters so much. For most people your age, the deepest fear is not the pill itself. It's losing your independence. A fall can mean a broken hip, a hospital stay, a loss of confidence, and sometimes the end of living on your own terms. So here is the honest contrast. Amlodipine is genuinely protecting your heart and lowering your stroke risk, which is enormously valuable. But that same power, in the wrong body at the wrong moment, may threaten your balance. Both of those things are true at once. This does not mean amlodipine is a bad drug. It is a very good drug for the right person. It simply means the risk deserves to be spoken out loud, which almost never happens. And there are specific, simple steps that dramatically reduce this danger. I'm going to give them to you in the action plan near the end, so stay with me. For now, we've looked hard at amlodipine's two trade-offs. To be fair and complete, let's turn the page and look honestly at Losartan, its quiet strengths, and its own risks. Now let's give Losartan the same honest examination, because it has real strengths and real risks, and you deserve both. Start with the good news. Because Losartan works by calming a hormone signal rather than forcing your arteries open, it does not cause that fluid-shifting ankle swelling the way amlodipine does. For someone plagued by puffy ankles, that alone can be a meaningful difference. But Losartan's most impressive strength is what it does for your kidneys. In people with kidney disease, and especially in those with diabetes, Losartan has been shown to genuinely protect the kidneys, reducing the leak of protein into the urine and slowing the progression of kidney damage over time. That is not a small thing. For a diabetic patient over 65 worried about their kidneys, this protective effect can be genuinely valuable, and it's a real reason a thoughtful doctor might choose it. So Losartan can look like the gentler, more protective option. But every medication has a trade-off, and honesty means telling you Losartan's too. Here it is. Losartan can cause your body to hold on to potassium, and that means your potassium level can climb too high. Now, potassium sounds harmless, it's in bananas after all, but when it rises too far in your blood, it can affect your heart rhythm and become genuinely serious. This risk is higher in older adults and in people whose kidneys are already working slowly. That's why anyone on Losartan needs periodic blood tests to check their kidney function and potassium. Here is the contrast that captures it perfectly. Amlodipine's side effects are visible. You can see your swollen ankles in the mirror. Losartan's main risk is invisible. You cannot feel your potassium creeping up. The only way to catch it is a simple blood test, which is exactly why those tests are not optional. If this careful, balanced explanation is helping you, type the word clarity in the comments so I know. And now, we arrive at the finding I promised you at the very start, the one about memory that almost no patient has ever heard. Here is the detail that surprises people the most, because we almost never think of a blood pressure pill as having anything to do with our minds. But a growing body of recent research suggests it might. Several large studies over the past few years have examined whether different classes of blood pressure medication are linked to different risks of dementia and Alzheimer's disease. And a consistent, striking pattern has emerged. The class that Losartan belongs to, the ARBs, has been associated with a lower risk of developing dementia compared to some other blood pressure drug classes. In one large analysis, people taking ARBs had a meaningfully lower risk of progressing to dementia than those on certain other medications. Now, I have to be very careful and very honest with you here, because you deserve accuracy, not hype. These studies show an association, a link, a pattern seen across large groups of people. They do not prove that Losartan prevents dementia, and no responsible doctor would promise you that. This is an active, exciting area of research, not a settled fact, and you should be skeptical of anyone who tells you a pill will save your memory. But the pattern is real, it is being taken seriously by researchers, and it's the kind of thing you have every right to know exists. Here's the contrast worth holding on to. Most of us think a blood pressure pill has exactly one job, managing the pressure in our arteries. But the truth is that the medication you take every single day may quietly touch far more than your heart. It may, in ways science is still working to fully understand, be connected to the long-term health of your brain. That is worth a conversation with your doctor. And it brings us finally to the honest answer you came here for. So, after all of this, which one is actually safer after 65? Here is the honest answer, the one a rushed appointment will never give you. There is no single winner. Anyone who tells you one of these pills is simply the safe one and the other is the dangerous one is not being truthful with you. Safety here is personal. It depends entirely on the body it's going into, yours. But that does not leave you empty-handed. Let me make it concrete. Losartan tends to be the more thoughtful choice if you have kidney disease, if you are diabetic and want to protect your kidneys, if you struggle with ankle swelling, or if the memory research we just discussed matters to you. Its gentleness and its protective qualities shine in exactly those situations. Amlodipine, on the other hand, tends to be the stronger choice when your blood pressure needs powerful, reliable lowering, when your potassium already runs high so an ARB would be risky, or when you have certain heart conditions where it offers specific benefits. Notice what just happened. The two drugs stopped competing and sorted themselves by the person taking them. That is the whole point. The question was never, which pill is better? It was always, which pill fits the body like yours? And here is the most important sentence in this entire video. This decision belongs to you and your doctor together. Nothing you've learned today is a reason to change or stop your medication on your own. What it is the knowledge to walk into that office and ask sharper questions, and to be a true partner in your own care instead of a passive passenger. Now, before we get to your practical action plan, there are some warning signs I need you to know. The moments when you don't wait for an appointment at all. Before anything else, I need to give you the warning signs that mean you should not wait, because your safety comes before every other point in this video. Most side effects we've discussed are manageable and worth a calm conversation at your next visit. But a few situations call for prompt medical attention, and you deserve to recognize them. Call your doctor right away or seek urgent care if you notice sudden, severe swelling in just one leg, especially with pain, warmth, or redness, because that can signal something other than a simple drug effect. Get help immediately for chest pain, for fainting or nearly passing out, or for a pulse that has become very slow along with extreme dizziness. If you're on Losartan, be alert for signs your potassium may be too high, unusual muscle weakness, numbness, or a heartbeat that feels irregular or fluttering. And for either medication, a sudden, significant drop in how much you're urinating deserves a prompt call because it can reflect a change in your kidneys. None of this is meant to frighten you. These situations are the exception, not the rule. But knowing them is part of being a truly informed patient. And here is the one rule I want you to promise me. Never stop or switch a blood pressure pill on your own, no matter how convinced you are. Stopping suddenly can cause your pressure to rebound dangerously. Every change happens with your doctor. With those safeguards clear, let's turn all of this understanding into simple things you can actually do. Here is your action plan. Simple, free, and something you can begin today. First, go find out exactly which drug you're on and which class it belongs to. You already started this at the top of the video, so you're ahead. Second, start a simple notebook. Each day, jot down your blood pressure if you measure it at home, and note any symptoms, swelling, dizziness, anything. Patterns on paper are powerful in a doctor's office. Third, call your pharmacist. They are free to talk to and wonderful at this, and ask directly about your specific pill's side effects. Fourth, if you're on Losartan, ask your doctor when your kidney function and potassium were last checked, and whether it's time again. Fifth, if you're on Amlodipine and battling swelling, Elevate your legs when resting and report the swelling rather than quietly stopping the pill. And when standing up, do it slowly to protect against that dizziness. Sixth, bring a written timeline to your next appointment, when symptoms started, when medications changed. Let's recap the whole journey in one breath. Amlodipine and Losartan reach the same goal by completely different paths, each with real strengths and real trade-offs, and the safer one depends entirely on your body, not on a headline. You are not powerless here. You are informed, and that changes everything. Make sure you're subscribed because my next video breaks down a third pill millions of you take, lisinopril, and how it compares to these two. If this helped you, share it with one person who takes a blood pressure pill. And tell me in the comments, did anyone ever explain your pill to you like this before?